Hello, I'm Laura Marcial, and I'm really happy to be here with the MCBK community today doing this lightning talk on e-care plan, round two. So, why did we embark on the e-care plan project to begin with? What problem are we trying to solve? Well, care delivery in most contexts is really fragmented, and for people living with multiple chronic conditions, even more so. With broad multi-stakeholder care teams, this fragmentation is really compounded. So, bringing together critical information for patients, caregivers, and their care teams is essential to providing coordinated, person-centered care. So, what is the e-care plan? Well, first and foremost, it's an effort to improve how we conduct research and provide care to people living with multiple chronic conditions through the exchange of interoperable data, leveraging smart on-fire applications. The goal overall is to improve capacity for patient-centered outcomes research, facilitate comprehensive care planning, and support quality improvement, and most importantly, to improve outcomes overall. So let's start with an example. Dorothea is a use case created to help develop a conceptual framework to understand the user experience for patients living with multiple chronic conditions. As a 65-year-old woman of color, Dorothea gets support from her partner and adult children. She has a team of 6 active care providers who coordinate care for her diabetes, heart disease, and depression. Dorothea might not initially identify with the concept of multiple chronic conditions or immediately grasp the level of coordination required to provide the care she needs. She'll need to lean on her entire care team, including her caregivers, her partner, and children. She likely won't initially see the extent of back and forth conversation needed to keep her care team informed, and she'll look for resources, people, services, tools, etc., to help support her care as her care team grows. We created a few videos to support folks like Dorothea as they get oriented to their multiple chronic condition person-centered care planning journey. So where did we conduct this work? The project was funded by the Assistant Secretary for Planning and Evaluation and developed in partnership with the Agency for Healthcare Research and Quality um, and the National Institute of Diabetes and Digestive and Kidney Diseases. The initiative created standards-based interoperable electronic care or e-care plan tools to improve care coordination for living with multiple chronic conditions, including those with long COVID. Round one work was completed in 2022, and round two was completed in late 2024. So, how do we execute the work? We divided it up into phases, beginning with an integration period, then testing in the clinical environment at Oregon Health and Science University, and then a launch and pilot period wrapping up with an evaluation. So when did we do this work? We did a rebuild of the My Care Planner and eCare Planner, the patient and provider facing applications in quarter 3 of 2023 and quarter 1 of 2024. And the supplemental data store was completed in quarter 2 of 2024. So we worked on integration and implementation, reached the testing and pilot stage in late Q3 and Q4 of 2024. In terms of My Care Planner, this patient-facing application provides both EHR-based information and opportunity to collect patient information such as goals or other patient-reported outcomes information, as you see here, physical function in that middle panel. The provider-facing application provided a view into data supplied by the supplemental data store to support a shared care planning encounter. As you see here, tabular and graphic information, vital signs and measures on the synthetic patient, Patricia Noel. So who piloted or participated in the pilot in round two? We had a mix of 43 patient users, 10 provider users, and a set of dyad users, and ultimately had a relatively good demographic mix for patient participants. We collected survey data, did some focus group work, and were able to observe these dyad sessions to really look at what shared care planning support was provided by the care plan. So, what were our results? Well, ultimately, different from round one, where the bulk of the effort focused on better understanding of the needs of patients, caregivers, and providers around shared care planning, we were able to more fully test the components of the system, so My Care Planner, eCare Planner, and the supplemental data store, and examine issues of utility, usability, performance, and viability. The evaluation was guided by the Consolidated Framework for Implementation Research Process Redesign Framework, and results indicated that patients and caregivers alike and providers found the information provided by My Care Planner and eCare Planner available, load times acceptable, and that that the tools help them create goals and supported the role of the caregiver as well. We also created a detailed implementation guide, relevant value sets, reusable assets, and other use cases as part of this work. So, what's next for the care plan system? A natural next step is to incorporate logics, clinical decision support based on existing guidelines and informed by artificial intelligence. Additionally, user-centered design enhancements, including better support for patient-reported outcome data collection for patients and enhanced information prioritization for care providers, are high priority items for future development. Leveraging data flowing through health information exchanges, working with other data sources, and improving integration into the clinical workflow are also important areas of development for the care plan. So I know that was really fast and furious, a lot of material to cover. There's a lot of good resources you can dive into, as you see linked here on this slide. We're always interested in opportunities to collaborate. Would love to have you reach out and discuss opportunities to extend this work. So thank you very much.